All the cool girls are mouth taping. So let's get hotter and smarter in 5 as we chat about the benefits of nasal breathing compared to oral breathing. So from a broad perspective, nasal breathing helps with our facial, oral, and respiratory muscle function, in addition to our skeletal structure of the face. So when you hear about mouth taping and nose breathing helping your snatched jawline, this is what they're referring to. And in PT school, we actually had a respiratory therapist come talk to us about nasal breathing versus oral breathing. And he said when he's grocery shopping, he can tell which people in the grocery line are mouth breathers versus who are nasal breathers based on how their face is structured. And I'll try and put a picture of what that actually looks like, because once you see it, you can't unsee it. And then everyone you notice with this pushed back jawline or this rounded curvature of the bottom half of their face, you will know that they are likely an oral breather or a mouth breather. So people who mouth breathe or oral breathe often get headaches. They often have alterations in head position in order to clear those airways, in order to get air through their mouth, because that's their primary mode and choice for breathing. They are often more fatigued, drowsy. They have their mouth open during sleep, which causes snoring. They can also have difficulty breathing at night and nasal obstruction at night when they're sleeping, because their head has to be positioned in a certain way in order to clear the pathway for air to get through the mouth rather than the nose. So I've broken it up into a few categories on talking about the various benefits of nasal breathing versus mouth breathing for things like sleep, respiration, brain function, and ending on posture and pelvic floor health, because as y'all know, that's where my expertise and passion lies when it comes to mouth breathing versus nasal breathing, and why I try and promote mouth taping for everyone. So when it comes to sleep, nasal breathing actually creates a lower risk for sleep apnea and a lower risk for upper airway resistance during breathing during sleep, which means overall less snoring. A lot of the brain benefits of nasal breathing compared to mouth breathing come based on how much oxygen we're able to deliver to very important parts of the brain. So evidence suggests that mouth breathing may be associated with an increased risk of impaired brain function due to lower oxygen saturation. And that's the amount of hemoglobin that our blood carries that carries those oxygen molecules to the necessary parts of the brain. So this has been further confirmed by multiple studies. So there's fMRI studies that have found that mouth breathing has led to impairments in working memory. So there was increased neural activity during working tasks in nasal breathers. When we're working on a tough project where we're needing a lot of that mental effort, nasal breathers showed increased neural activity when they were actually working on that task compared to mouth breathers. fMRI studies have also found that mouth breathing has led to impairments in smell memory or olfactory memory, mathematical abilities, learning skills, and they've also found that mouth breathing showed lower blood oxygenation to the hippocampus, brainstem, and cerebellum. For children, studies have also shown lower achievement of academic skills in mouth breathers compared to nasal breathing children. EEG brain studies have shown that mouth breathers had decreased theta and alpha waves at rest and during various mental tasks compared to nasal breathers. And nasal breathers have also shown increased neural integrations for things like self-awareness and consciousness. And lastly, nasal breathers have also shown improved reaction time to fearful stimuli, as well as increased accuracy in visual object recognition. For respiration and breathing, oxygen saturation and respiratory rate significantly decreased during mouth breathing compared to nasal breathing, which might lead to postural deficits we see for mouth breathers trying to get more oxygen. As we can see, a lot of it has to do with how much oxygen we're actually able to get to muscles and then also to our brain, and the pathways that we're able to receive that oxygen either via the nose or via the mouth in order to successfully breathe. So lastly, when it comes to posture, and your pelvic floor goes into that, of course, mouth breathers typically have that forward head posture because they're trying to shift their actual structure in order to increase the amount of oxygen that they're able to intake via their mouth, because that is their preferred way of breathing. So forward head posture, which means they oftentimes have overuse of the neck muscles. A lot of people with neck pain will often be mouth breathers. This is a generalization, but we always check how they're breathing in order to tell, Are they overusing some of those neck muscles, or are those neck muscles super tight because they're having to position their head in such a way to breathe through their mouth, which is the way that they prefer to breathe? Because of that forward head posture, they also can have poor efficiency of their overall breathing muscles. So if you guys have listened to our episodes before, you know that breathing a lot of the time is focused on the alignment of your rib cage over your pelvic floor, how the diaphragm is able to descend, how the pelvic floor is able to descend, in order to create this like coordinating system for respiration, for bowel movements, for a lot of different things within that like thoracic and abdominal cavity. And if your head's forward, that's automatically throwing the system off. So you can have poor diaphragm function and coordination, in addition to poor pelvic floor function and coordination when your head's forward. That's typical of people who mouth breathe. Mouth breathers are often also chest breathers, meaning forward with the chest and using some of those accessory breathing muscles rather than the primary breathing muscles in order to accomplish that goal of respiration and getting enough oxygen. But with chest breathing, we're limiting that expansion of the diaphragm, we're limiting that expansion of the pelvic floor, we're just having an overall poor musculoskeletal coordination of respiration that's going to lead to things like possible neck pain, possible low back pain. So not only is it affecting the brain, your working memory, your reaction time, but it's also affecting some of the like physical symptoms that you're getting when it comes to pain. And then lastly, mouth breathers often use those accessory breathing muscles more because a lot of the time that position is off. And so they're forced to use things like their sternocleidomastoid, that really big muscle in the front. They're forced to use some of these intercostals, that these accessory breathing muscles are utilized during laughing and coughing and heavier, forceful tasks for breathing, heavy exercise. It should not be your primary way of breathing when it comes to breathing at rest. And people who mouth breathe or oral breathe oftentimes use these accessory muscles when they don't really have to. So that can create a lot of tension in different areas that don't necessarily need to be having tension. So now we are all a little hotter and smarter now that we know the benefits of nasal breathing and how mouth tape can help.